Welcome to our Axios Pro Healthcare Policy virtual event. I'm Maya Goldman, Healthcare Policy Reporter for Axios Pro. I'd like to welcome our audiences on Facebook, YouTube, Twitter, LinkedIn, and on Axios.com. You can join the conversation today on Twitter with @AxiosPro and #AxiosPro. Over the next 30 minutes, I will be joined by my colleague, Peter Sullivan, and we'll dive deep with two leading lawmakers on some of the key healthcare issues Congress will debate in 2023. Our first guest is Indiana Congresswoman Victoria Spartz, joining us today from Yuma, Arizona. Thanks for being here, Congresswoman.
Thank you for having me.
Absolutely. We're very excited to talk. You introduced a whole suite of bills last year to lower healthcare costs with policies that would get rid of prohibitions on physician-owned hospitals and require transparency in hospital billing, just to name a few. How did you arrive at these solutions?
Well, I'll tell you something, I guess, in my real world, before I got involved with politics, I was, a small business owner. I was a working mom, work crazy job to be able to afford health care. And I did audits of large corporations. And when I did that, I saw how these numbers of spending on healthcare become an wage suppression for a lot of companies and become less and less sustainable. But I also saw what it does to people, where we actually have more and more control of healthcare by bureaucrats and not doctors, and people don't have a decision about healthcare, don't have speed and agility and value. So when I became a state senator, I decided, well, this is very material issue. It's not something really, you go and talk a lot about it. A lot of people don't want to take a deep dive, but it's extremely important because it affects every American. And it's becoming, the cost of healthcare is becoming not sustainable, and it's bankrupting at the federal government. So, I started working on these issues, and I realized that it's not an easy thing to do. But you know what? I was always very determined, because this is something that's very important. If we have a government takeover of healthcare, it's going to destroy healthcare value, and particularly innovation that can save a lot of lives.
Yeah, and you introduced your bills alone last year, but you've gotten some bipartisan support since then. And we'll actually hear from Representative Custer next, who plans to co-sponsor your hospital billing transparency policy when you reintroduce it. What other feedback have you gotten from Democrats on your bills?
Well, I'll be honest with you, this shouldn't be a bipartisan issue. This shouldn't be a partisan issue, because this is an American issue. And I introduced some bills because when I work on this issue in healthcare policy task force that Leader McCarthy put together last Congress, we actually include a lot of talking points in our press releases, but I said we need to do more than just talking points. So I said, okay, I'm just going to introduce these bills to socialize ideas, to find other people who are interested to work on these issues, and try to reach out on a bipartisan basis to get things done, because we have to start governing. We have to start dealing with our debt. And a lot of people don't understand, if we want to save Medicare, which we do want for our seniors, we need to start dealing with some of the fraud and abuse in the system, including, people say dishonest billing. I call it fraudulent billing, but definitely it's a huge impact to our budget, and Medicare is going bankrupt. So I think we should become less political and find common ground. I talked to other members also in the Senate on both sides of the aisle, and I'm going to spend more time, this Congress, to really try to educate some of my colleagues, because there are some issues that are very sexy. Everyone wants to go on TV and talk about that. Healthcare is not, as popular, but it is very important.
Yeah. Do you have a plan or a timeline for when we can expect to see those bills reintroduced to this Congress?
Well, I've been in politics long enough, and I understand that you have a very short time frame when people want to work on legislation. And then we're going to get into politics and presidential election next year. So I definitely want to do it as soon as possible. I'm working with CBO and some other people just to see if we need to make some adjustments, and going to work right now actively to get sponsors of the bill. I work with the committees that we're going to have hearings in Energy and Commerce, working with Ways and Means and also Judiciary Committee to have similar hearings on healthcare competition and hospital competition. A lot of people don't realize that 50 to 60% of healthcare spend is hospital spend. And a lot of people don't realize that we pretty much had hyperinflation of price of healthcare, not the cost, but price. And this is unsustainable. And we have a huge monopoly problem. And for me, it was very interesting. I studied economics when I was young. It was interesting for me to see that some of the economists were pushing consolidation and saying that you might be able to have more efficiency. I've never seen monopolies being efficient, and being competitive and providing value. But unfortunately, this is government created monopolies, government controlled monopolies, government subsidized monopolies, and we need to stop it if we really about we the people, if we do care about that. And I hope find bipartisan support.
Be interested to look out for those hearings. But that's a great segue into my next question. Hospitals have a very powerful lobby here in DC. Most congressional districts, I think including your own, have at least one hospital. How has the industry reacted to your positions? What kind of pushback have you received?
Well, I'll tell you something. As I said, I've been legislator for some time. I am not as wise enough yet and have energy to give up, but I'm very determined because I think it's very important. When I became state senator, I couldn't get a summer study on hospital competition. I couldn't even get any radio newspaper write about it, to talk about it. And so it was very, very difficult, and I understand what a machine it is. So it took me some time, find some allies, work with people, work with some employers, work with small businesses, and try to put pressure on politicians too, including in my own party, not just on the other side, because we have a supermajority, it's a Republican supermajority in the state of Indiana. So they were not very happy. And Chair of Commerce almost endorsed my competitor, my opponent in my general election, which I'm probably the most pro-free enterprise Republican in the whole state legislature, and small businesses and manufacturers stood up with me. I actually recently met with union members, and I said to them, this is something you could be a strong ally for me too. We might not agree on every issue with you, but this is an issue that's important for your members. And if you want to have higher wages, we need to have a discussion why we have such a high hospital prices and healthcare prices. And, we have a lot of hospitals in my district building Taj Mahals, have billions on Wall Street, and the executives make a lot of money, and we send huge subsidies for that. And people have a harder time to get proper healthcare and more timely healthcare and more innovative healthcare. So I think it's becoming a huge problem. And I think the more we talk about this, politicians will start moving. So I recently went actually testify in Indiana Senate committee in support of some of the bills they're doing, and had a discussion with some of the people representing hospitals. And I said, you know what, you have so many billions now, you should be not afraid to compete. And maybe we can try to find common ground, because otherwise we'll have a full government takeover of healthcare, and no one wants it because people will get so frustrated. So we'll see. I'll try my best, but I definitely understand it's not easy, but you know what, it makes us stronger.
Yeah, some of your policies touch on nonprofit hospitals as well. And I know, safety net hospitals make up a big portion of the hospitals in this country. Not that those two are necessarily the same thing, but how do those fit into this conversation? Nonprofit hospitals.
Well, I said, listen, like next business I'm going to have is going to be nonprofit. You don't pay taxes, and you can pay yourself as much salary as you want. You don't have to follow all of the rules and regulations. So it's a very clever way to do. But unfortunately, if we continue to have some businesses being tax exempt without have clear rule, it's very difficult then for any other businesses to compete with them, because they don't pay state taxes, they don't pay federal taxes. A lot of times they don't pay property taxes. So they're full subsidy. And on top of it, we allow them to absorb smaller enterprises, because we don't allow physicians to own hospitals, or we allow them to bill much more and under their main license, in even and some of the entities they just purchased. So they're absorbing more doctors, and really the practices will be gone soon if we continue on this path. So that is actually a huge problem, because it's also access to healthcare, and especially rural area getting affected by that, like that too, significantly. So I think there is a lot of challenges with that, but I truly believe that we can move the needle in the right direction, and if people understand what it is, and if people understand that, there's maybe it was intent, at some point to make some ancestry nonprofit, but they're making a lot of profits right now, and they do a lot of things, that they probably shouldn't be doing from my perspective, and not compete and deliver value for the people in healthcare. And I think we have to clarify our rules. The standards needs to be not as vague. And as a former auditor and the CPA, I was shocked what a lax rules, we're applying to some entities like that.
You recently announced that you won't seek re-election to Congress when your current term ends. So what kind of progress do you think is realistic to see in the next 2 years on these issues? What's your marker for success when you leave office?
Well, but honestly, now I have more time to deal with this issue, which is good because I don't have to worry about fundraising and other things, so I can be even more dangerous. But in reality, I think, it's very important. And I'll be honest with you, in political and in any legislative branches, it's a slow moving branch. And it's okay. We never really meant to be, fast decision makers, but we need to move the needle. We need to create a different culture and priorities and thoughts. And healthcare should be one of the main issues that we should care about, working on developing real policy. Unfortunately, a lot of times until crisis hits, people do nothing about it. And I hate to say that, but crisis is an opportunity, and we're getting closer to having a crisis. I hate to say that. If we can be proactive, I would love it. But even if we cannot be proactive, at least let's have good policy, because when we do have crisis, we at least will start legislating smart policy, not stupid policies. I think we should have healthcare discussion and all this spending as part of our debt negotiation and discussion. It should be a bipartisan issue. We should eliminate fraud and abuse in the system. But I think, even I left Indiana State Senate, we still were able to create a culture. And I spent a lot of time that where legislators are not afraid to think about challenging the status quo, challenging big special interest group, be able to deliberate ideas, and be able to bring some tough legislation to discussion. So I will work, hard this Congress to make sure that we do have it. And I hope we can do it even on the bipartisan basis, because if we do, we'll put a lot of pressure on large special interest group like hospital monopolies that really control a lot, and particularly in the Senate, but that's a different thing that we need to discuss. But ultimately, we will be able, if on a bipartisan basis in the House, we're able to get together and do something with the people, I think we can put pressure on the Senate too.
Well, that's all the time that we have, but thank you so much for your insight, Congresswoman.
Thank you.
And now over to my colleague, Peter Sullivan, for our next segment.
Thanks, Maya. I'm Peter Sullivan, healthcare policy reporter with Axios Pro. And joining me is Congresswoman Annie Kuster from Concord, New Hampshire. Thanks for joining us, Congresswoman.
Great to be with you. Thank you.
So I know you're active in a lot of healthcare fronts, but maybe let's start with I know one of your focuses is mental health and substance use issues. Just kind of broadly to start out, what are kind of your priorities this year in those areas in Congress?
Sure. Well, I'm the founder and co-chair of the bipartisan task force on mental health and substance use disorder with my colleague Brian Fitzpatrick and David Trone. We're lining up our second Republican co-chair as we speak. But we founded this a number of years ago, actually, Frank Ginta and I, also from New Hampshire. And it's continued in various iterations, including welcoming David Trone and his group from the class of 2018. It's very bipartisan, very engaged on the co-occurring illness of substance use disorder and mental health that typically go hand in hand. And we take a broad approach. But this session, I think, will be particularly focused on coming out of the COVID-19 pandemic and what was helpful for people, things like telehealth that really made a difference in providing access to treatment, making sure we continue telehealth, and what were some of the challenges. We actually saw rates of substance use disorder, deaths from overdoses. The issues around fentanyl actually get worse during COVID-19. And so we really want to work together on both access to treatment, long-term recovery programming, including housing, but also hand in hand with our law enforcement community on how to stop the flow of fentanyl into our community.
Yeah, I know on that fentanyl issue, and Republicans on Energy and Commerce have put a big focus on their Halt Fentanyl Act about scheduling fentanyl-like substances. Where do you kind of come down in that debate around scheduling, or how do you think we could kind of deal with that issue?
Yeah, it's a tricky one because we do need to work within the system that we have, which is scheduling, to make sure that fentanyl does not get into the hands of people that are not using it for a legitimate purpose. What's challenging with fentanyl is it does continue to have a legitimate purpose within the medical field, used by physicians, by surgeons as a pain management technique. And so working with our partners in law enforcement to keep illicit sources of fentanyl out of the hands of people that are users in the community is the biggest priority. And I think what we've seen is that the precursor elements from fentanyl are flowing from China to Mexico, and then the pill mills, if you will, are churning out record numbers of pills that are coming in through the ports of entry. So sometimes this issue gets politicized. We get off track talking about building walls at the border. What we really need to do is be working together in a bipartisan way, focusing on the points of entry and focusing on stopping the flow of fentanyl. What's so challenging is just the sheer size of it makes it very difficult to detect and very easy to ship across the border in vehicles and containers. Fentanyl is 100 times more powerful than heroin. So very small doses of fentanyl can actually be lethal. And you can see from the over 100,000 Americans dying every single year, most of those deaths now are fentanyl-related overdose deaths.
Got it. Well, to shift gears a little bit, I know you and actually our other speaker in this event, Congresswoman Victoria Spartz, have a healthcare cost bill that you're going to be putting forward around hospital costs and hospital billing. Can you talk a little bit about that and what are your goals there? Do you see a path to passing that in this Congress?
Sure. I'm delighted to be working with Representative Spartz again in a bipartisan way. This is an issue that has come up for many years, frankly. Even before I went to Congress, I was aware of this. I've had this experience myself when my children were younger, going to an urgent care that was part of a facility that was connected to a hospital, and then getting a bill for services as though you were at the emergency room of a hospital. So people have been questioning this for a number of years, which is when physicians join the practice group that's owned by a hospital, or when a hospital takes over a facility that is for outpatient care, what we find is that sometimes the billing codes that are used charge the inpatient hospital rate or the in-hospital service rate. And both the consumer and the payer, in this case, the taxpayer, pay more than they should. And so this is an extremely expensive issue for Medicare, Medicaid, and for private insurance. And obviously it flows all the way through to the copay that a family might be paying. So this is a bipartisan approach to require that services be billed and coded for billing based on the location of the service. And that will save hundreds of millions of dollars for Medicare And hopefully those funds can be then redirected to address some of the issues that hospitals are facing. I know recently I had an event in New Hampshire about nursing education that's so important, where our workforce issues are really straining hospitals. We have a lot of rural hospitals in my district, and during COVID, they had to bring in traveling nurses at great expense. So there's a number of issues that could be worked in together, and that's what we're working on right now. Provide solutions and lower costs.
Yeah. Do you see kind of a path to, is Energy and Commerce interested in this? Do you think you can move forward? I understand, you maybe have to deal with some opposition or concerns from the hospital industry, at least.
Well, I think what's interesting is the payers also have a lot of clout, and we'll need to work with the hospitals so that they understand what the goal is and make sure that we're addressing their needs as well. But I think this is something that's been a long time in coming, and it's just great to have bipartisan support. I expect our committee will be very interested.
Yeah, and let's zoom in on something else. You mentioned the sort of healthcare workforce. A lot of hospitals, other health facilities have nursing shortages of healthcare workers. Where do you see that can be done in that area?
Well, it's critically important. I'm also the co-chair of a new long-term care bipartisan task force that's going to be very important. This baby boom generation is aging, and we need workforce for long-term care, for hospital care, for outpatient care, and for mental health and addiction. It starts with our youth and STEM education, but then it's a pathway to a successful healthcare career. Here in New Hampshire, that starts at the high school level, career and technical education, where young people can get an LNA in high school, during high school, and graduate with that first step so that they can go work in a long-term care facility. And then they work their way up through the community college system, through the four-year college system, all the way up through registered nurse, nurse practitioner, and PAs with, jobs that have real career path, real security in our community economically, and provide a big boost to providing healthcare to our citizens.
Got it. Well, thanks so much, Congresswoman. I think we're out of time, but thanks so much for joining us today.
Great to be with you. Thank you for all your interest. I know Axios has been very involved in following healthcare, delivery of healthcare, lowering costs, making sure we provide access and improve the quality of people's lives in every district, wherever they may be. So thanks for your time.
Of course. Thank you. Thank you all for joining us this afternoon for another virtual conversation that has made everyone smarter faster. For the latest on what's happening in healthcare policy on Capitol Hill, or to subscribe to Axios Pro, go to axios.com/pro. Use code POLICY100 to get $100 off your subscription to Axios Pro Policy. Thank you again for joining, and we'll see you on axios.com/pro.